Welcome in, everybody. Welcome in. Today we are live. Thank you guys for taking your lunch with us. We are so excited. We are here with Dr. Lee. Dr. Okoro will be joining us soon. So stay because it's going to be one of our best lives this year, guys. I'm going to answer all of your questions with the help of our plastic surgeons, of course. Welcome in. If you guys have any questions, start asking them now, guys. Welcome in. Welcome in. Hello, Yo Maxwell. Perfect. There we go. We are good.
Okay, whoa, tighten that up a little bit.
We had some technical difficulties that are now resolved, and we're ready for you
It's
guys.
good food. We're on time. We are just on time.
We are just on time. Welcome in, guys. So for this live, we're going to be answering your most popular questions. If you want questions on facial rejuvenation or plastic surgery when it comes to mommy makeovers, BBL reductions, this is your time to ask, and I'll give you guys the mic.
All right, you go first.
All right, well, I'm Dr. Lee. We're here at Georgia Plastics, and I'm so excited to be here. If you have questions, and it's not just female plastic surgery, we do males as well. There's some exciting things for guys as well that we're going to be talking about. The face, the breast, the body, anywhere that has skin, and even the hair. So, hey, that's interesting.
My name is Dr. Stanley Okoro. I am the bow tie plastic surgeon, no bow tie. We're going to be talking, nothing is off the, anything. So we'll talk about face, breast, body, men's health, women's health. So anything or nothing is off the table. Yeah, this is it. Anything you want to ask about. So ask your questions on the chat, and they will read it to us. Some people have been asking questions already. So we're right in Georgia, Atlanta, Georgia area, and I'm ready for it. So I just don't know what
All right, we got some questions. All right, they're coming in hot right now. Okay.
Awesome.
So, how soon can I return to work after facial surgery?
Ooh, so what kind of surgery? Yeah, it depends on what it is.
So we're talking about eyelid, rhinoplasty, facelift.
Okay.
Which one do you want type one?
I will say deep, well, if it's a major surgery such as deep bone facelift or even smash facelift, it depends. So if you work from home, then turn your camera off and go back to work the next day. Most of the time, facelifts don't hurt. All my patients have always told me they're actually quite comfortable, and we still send you with medications.
How about the bruising and the all the stuff?
It depends.
Swelling.
I would say swelling and bruising is part of it is, keeping upright, but a lot of it is your own genetics. Some people are swellers, some people are bruisers, and so it depends on you. There's certain things you can do ahead of time to kind of decrease everything, but again, it's unpredictable. Some people are fast when they get surgery, and some people are slow.
But I mean, we probably want just to play safe. You want to at least 1 to 2 weeks off.
Oh,
You have a plan in there. And after facelift, we don't want to see you in the office the next day. Just to make sure all is good. That's just how we do it. We do the plastic. How about eyelid? It's still facial. We're going to go down.
Yeah.
Right? We're going down?
Yeah.
All right. Eyelid surgery, upper and lower eyelid surgery.
I would say for eyelids, you could get bruising. Even though if you just do the upper eyelid, you can still get bruising on the bottom eyelid too. So just be aware of that. It's not a shock. It's completely normal. Yeah. And I would say again, about 2 to 3 weeks, give yourself some time. You will look like a raccoon, and that's also normal.
The all swelling will go down eventually. Rhinoplasty.
Yeah, and we actually got a once-week coil said, I'm interested in getting my jawline and chin tightened. So what about for that?
Okay, so it depends. So we that's actually one of my favorite procedures. I just did one this morning, right? So it depends on what you're talking about, right? So if you want to smash jawline and neck and stuff like that, we offer so many options. So we have surgical and non-surgical options. So if depending on your situation, if you like non-surgical options, some do a wireless this morning. It's beautiful. And so it's like a closed facelift procedure with using fillers. And the fillers is about location. So yes, fillers, people have all kinds of information about fillers, right? I mean, does it go away?
Also, that's the question. What the company says is certain fillers last 1 to 2 years. Other companies say like their fillers last 3 to 4. But then there have been studies showing that fillers that have been placed for a
saw a picture I didn't have 4 years ago. Yeah, it's still there. So with the wireless, I use it to kind of snap the jawline, the chin, the cheekbones. So it's about I call it the leading edges of your face. It's 1, 2, and 3. And it makes you look great. And if you have excess fat under your chin, we can suck that out as well. And tighten the skin. We use face type or quantum and Morpheus, right? And then if for some reason you start loose skin and you don't want a face or neck, we can put like a suture that's like contour next to it, right? And then if you need a facelift or neck lift, that's that's a nice segue. So it all depends on what you need. You really need a consult because there's no one size fits all when it comes to facial rejuvenation.
Exactly. And I think that's the exciting part of being a plastic surgeon. We have all these different tools and we know all about all of the tools. And every patient is unique. And so not one tool, you're not going to use just one thing in your box that helps them.
Yeah. So there's a thing that says if you have a hammer,
Yeah.
everything looks like a nail.
Mm-hmm.
So let me say it again. A lot of doctors have hammers, and every patient looks like a nail. Just think about that. So we have the privilege of having the needle and the nail.
We have both non-surgical
And
and surgical.
surgical. And sometimes there is not even a needle or not. We can also have other things that we can use to kind of rejuvenate. So the best advice is when a patient comes to me and just tell me what you want. And then we come up with options. There's no one way of doing it. In plastic surgery, there's no right or wrong answers, right? It all depends on what your priority is and what your preferences is. Yeah.
All right, guys, if you have any questions, if you're just joining the live, ask away. We have our plastic surgeons here from Georgia Plastic in Atlanta, guys. Go ahead and send over your questions. We got a few more questions that came in. So she said that she has a keloid. Do you guys recommend plastic surgery if she does?
So we have many patients. We're in Atlanta. I love the diversity in Atlanta. So we see so many patients with keloid. It all depends, right? I think keloid. I like to start with prevention. Prevention is very good. So I don't let keloid stop you from making you look amazing, right? So if you have keloid, so we can. Actually, in surgery we always but tissue handling. So we think about keloid or hyperpituitary in surgery before we do any kind of cut. We're gonna assume everybody's gonna have it. So we try to prevent it in surgery. The kind of suggestions we use and how we manage it. We have our scar management. So if you have it, and we treat a lot of patients with keloid from other practices as well, because they don't have that experience with keloid. We do.
Perfect. All right. And Angie Soto says, so do the amount of cc's you recommend depends on your current breast size? If someone that has an A cup gets more cc's versus a person that has a C cup?
Wow, that's it.
That's
So I guess we're done with the face.
Yeah.
We
are rapid fire questions here today.
Yes, this person is with us, so we are talking about it. So breast. So yes, breast enhancement outcomes. Okay, it's a breast enhancement. So you can do fat, alloclay, breast implant, and we have different kinds of breast implants. And again, not one size fits all. Some of our patients want nobody to know that have breast implants. Some people want their family to know, and some people want their friends to know, and then some people want everybody to know. So we call that a business decision, right? So it all depends on where you are. So there's no particular CC we have. So once you come somewhere, just tell us what you want, and we better than Disney, right? We make your dreams come true.
Yes. And I always tell my patients during the consult, I don't really like cup sizes. I just want you to try on some implants sometimes and see what it looks like when it goes on, and if that's what you're looking for, then that's the goal for you.
Yeah, some people really like kind of on the C cup and the D cup. It may not look good on you,
Yeah.
right? So don't worry about what somebody tells you about C cup. A C cup may not look good on you, maybe a D cup. But we don't talk about D cup. Let's see what looks good on you, right? On you, not on somebody else. Right?
fits your body.
what fits your body. But if you want to stick with that, that's okay. We can talk about that as well. So, but the most important is get a consult. We can offer a consult virtually or in person. We have patients from all over the world that come to us.
Yeah, and once Q wants to know, so she had her breast implants about 3 years ago with Dr. Parker, and now they're a little bit starting to sag, and she wants to know if there's anything she can do to prevent this.
Absolutely, absolutely. A few years ago, I've been standing this around for a long time, think that aging is inevitable. Looking older is optional. Breast implants will probably last you 10 to 20 years. But the breast itself on the side, I like to practice, I like to prevent. I'm often, all of my patients that have breast implants, skin tightening, I've done Morpheus, Quantum, and a body type. We call it the scarlet breast lift. So it is possible to lift the breast without a scar. Not everyone will qualify. So yeah, just come see us. If you're already a patient of Georgia Plastic, we're not going to charge you. Just we do that. Because you probably need to come see us. We need to do an ultrasound on the breast to make sure the implant. You need to come and get an implant checked out.
You hear that? Plus, we miss you. We always miss our patients. We love when they come back. They'll bring us food. So yes, if you want to come back, feel free to give us a call.
Call
or
the
DM us.
office. Call the office and schedule your follow-up appointment. We do an ultrasound, check the implant capsule. If you've had a breast implant, you need to see us regularly anyway. So we haven't seen you in 3 years, so you gotta come and do that, and then we'll evaluate if you need a. Some people need a traditional breast lift as well.
Yeah, she says she will call. And
Okay.
then we also have 650 and you. She says, I'm desperate need of BBL reduction. I'm so depressed. I hate how big it has gotten, and I'm not a big girl. Help! I want it done.
So we're going for the face, breast, down to the bottom.
We are everywhere here today. This is.
Okay, so she went there.
And she said, "Let's go
we're
there."
going to the
Okay,
butt now.
let's go.
Okay, let's talk about the butt.
Let's talk about the butt.
Okay,
Yes.
what about the butt? She wants a quantum butt.
She wants a quantum butt. We also had that question. What is a quantum butt? So she wants a BBL reduction, right?
Yeah.
She's not a big girl, so having a big butt just isn't in her plan. You know, what can she do?
All right, so before I want everyone to write this down. Because in April of this year, we actually published our series. It's open to everyone. So if you type or Google latest trend in buttock aesthetic, latest trend in buttock aesthetic, it talks about our experience at Georgia Plastic using a combination of technology that including the quantum, body type, Morpheus, of course, like to reduce it. People want to have the quantum butt, right? It's not a saggy butt, but a perky butt, right?
Yeah.
And we've done a research. People don't want a big butt anymore. They want a nice looking butt. They want something fit about it. We should go big or go home. That's gone. People want a nice butt. One of my famous patients, I did. We talked about this. We came up with like a professional video. That's what people are doing. So I hope I answered the question, but call us. What was our phone number again?
Yeah.
Yeah, okay. We see that. 770-485-15. No, 4. Is that it?
Yes,
1554?
Yes.
We have another one on the website.
we do have a different one on the
Yeah,
website.
get that. Thank you. All right.
Yeah, so she wants a perky butt. You know, she actually went on weight loss medication. And on the website we have 470-285-7368, guys. If you haven't written that down, that's 470-285-7368. But yeah, she wants a perky butt. You know, she lost a lot of weight. She went on her weight loss shots, but now she's ready to have a butt that matches her body
Yes, so
type.
the one who has been to experience with GLP-1, like the weight loss drugs, or the
So they're pretty amazing. Like all the patients are super happy, but because you're losing so much weight so quickly, you end up with saggy skin. And so it just like everybody says, it's all dependent on the individual. If you have a ton of extra skin, there's only so much skin tightening and liposuction can do. You may actually need an incision, but the way we do it is that we hide it in natural curves and crevices so that the scars aren't noticeable.
many, there's some people that will have to color excessively. The vast majority of patients who will benefit from skin tightening, we do skin tightening inside and outside. So with inside, we use body type of 1, 2. I love 1, 2, 4. And then on the outside is more so. That's what you need. The more the things that people worry about, we're going to remove all their fat and have a flat butt.
We make sure it stays perky,
Yes.
nice, and very natural.
Then natural.
So, I have someone that says she doesn't have any fat left to transfer, right? She's thin, but she wants to make her butt more round and full. Are there any other options? She has a long, wide butt. So.
Absolutely, we love the so this is something that we Georgia Plastic, very few plastic surgeons that have access to this. So we're going to introduce. Can somebody bring the thing for?
The surprise.
The surprise thing. I want
My favorite
yeah,
thing.
So it is here. Technology has allowed us to now transfer other people's fats, and it is safe. FDA approved is good. If you don't have enough fat, we got you.
Yeah.
So what am I talking about? So we're gonna unveil this when it comes, okay?
Yeah.
I want to throw it, I want to catch it.
Yeah.
Yeah. I'm gonna go out on a limb, I'm gonna catch this. Mid-air while we're live. How about that?
Okay, let's see who can make it. You guys think he's gonna make it?
I'm gonna catch it.
I don't
know
know.
the skills, but
I won't intersect.
His plastic
So I'm
surgery
gonna catch
skills.
it. So tell her that I want her to throw it to me. I'm gonna catch it.
And she's gonna catch it. Okay, guys.
Yeah,
Also,
I'm gonna catch it.
he wants to catch it.
You have to
throw. He said he's gonna catch it.
Yeah, bring it out and then you throw it from there.
All right, she got it. She got it. Let's see if he can catch it, guys.
Bang.
And he woo!
got
Ding, ding, ding. We need like a
The
bell.
hands are good. So this is what? Aloe clay. So this is real.
This is a real.
This is a real aloe clay. So this comes in syringes like this. This one's about 12.5 cc. So this is the real fat, all of this fat. So we inject it anywhere. We have used this in the face, breast, of course, the hip and the butt. We use it for cellulite treatment. We combine this with algae. So we release the strain. What do I call it? Septal network, and then we use it to count it. So this is real. That's what it says. So this is aloe clay. So if you don't have enough fat for your hip depths, and you don't want to go through liposuction, you don't want to go through surgery, you don't want to go to sleep, you don't want to have a recovery, you want to go back to work early.
Boom.
Am I talking to you? Or you have those cellulites and you want to fill in the little dips.
Yeah. And I would say that this is very, very popular. We've gotten people from all over the world looking and contacting with us.
It's not available anywhere else in
Yeah.
this world, only in the USA.
Yeah. And only a few practices have it, and in Georgia, we wanted to.
There's one or two of us here. Yeah, we have the early experience, so we have the most experience in Georgia.
And it sold out like
It
so
is-
fast
yeah,
when we first
If
got
you
it.
want it, you gotta call right now. You gotta book because this is on short. What is called again? The
Yeah.
back order.
Yeah.
Mhm.
Back order. So because we have so many demand for this,
Yeah.
so not everyone can get this. By the way,
And I will say everybody that I've injected this with have been super happy with the results.
Yeah.
So we're excited to see the luster.
If you go on, I think there's some before that.
Oh, on our Instagram, yeah.
Instagram and
Or DM me and I'll send you
Yeah,
guys the
so
before and after.
So that's aloe clay. So that's it. Yeah. So aloe, how you spell that?
ALLOECLAE.
Oh, no E.
ALLOCLAE. Aloe clay. Yes.
Because they need to have to Google it, right?
Yes.
1A, 2L,
1O
O,
C
L, A, E.
E. Aloe clay.
Aloe clay. Okay. Can you catch this?
I can't.
I don't know if I trust her.
I was a major.
Oh, she said hello.
Boom.
Oh, she got it.
One hand, so, okay,
If
she
you
got it.
guys are just joining in, ask away your questions. We are live for probably just a few minutes, guys. I want to make sure all of your questions get answered. We have a few questions that came in on our DM. Ask away your questions. If there's any questions you've ever had for a plastic surgeon, now is your time. And if you're too shy, DM me. Maybe next time we go live, I'll answer your
But
questions.
don't mention their name, just come and ask the questions.
Yeah.
Don't get that shy.
Yeah,
So,
if you're shy, let me know.
Let's get some of those questions that people were sent.
Yeah, let's go ahead. So let's see. Can non-surgical treatments like Morpheus or FaceTite replace surgery?
It depends on the patient. So if you have a ton of black skin, the skin tightening can only do so much, and people respond to skin tightening. Some people have great responses, and some people, their skin just doesn't respond. And so it will never replace surgery if you're not a candidate for non-surgery. So that's why it's so important to have a consultation, because,
Yeah.
if you tailor everything or your options to base what we think can help you.
There's also those patients that need surgery,
Yeah.
but don't want surgery. Don't want surgery now, or don't want surgery ever. So depending on where you are, maybe you're not ready for surgery, that's what the FaceTite and the some of the things kind of, it's like a bridge to the future, right? I like building bridges. Bridges good, because that way you're not burning any bridges. Yeah. So let's build more bridges, so whenever you're ready for whatever you do, so that's it.
And I have a few people that have DM me. They want Botox. They're afraid of needles. What is something you would tell them? Would you tell them, don't be afraid of needles? It doesn't hurt that bad. I personally was before I got Botox, and once I do, it hurts like nothing. It doesn't even, I don't really feel it. But what would you tell that person? Are there other options like Botox, or would you just say go through with the Botox? It doesn't hurt. What is your opinion?
Well, I mean, speak for somebody who's afraid of yes. There's a big secret now.
Ooh.
I'm a surgeon. I love needles and knives. But I freak out when I see needles. I really do. That's a secret. But I've also been doing Botox for the last 20 years. That's another secret. Okay? Most of my friends look older than I am. They're like, yeah, but I don't think it's okay. Botox, I do it every 3 months. And I do it. It's not bad. We do it so you look amazing, not look like you're already done. So we have Botox, we have Daxify. We use the smallest needle on the planet, 31 gauge needle, baby needle, and we remember that if we need to. We have all these things to do. It's not that bad, okay? I mean, do you have a tattoo? Hello. You got a tattoo? It hurts. Tattoo hurts more than the
I think we try our best to distract you. We have vibrating devices that are proven to help distract.
vibrator?
Yeah, or implants. We hold the implants in our hand.
You got implant and vibrator.
A vibrator, that's what we
We
have.
can numb you up as well, topical numbing. And so I too am scared of needles. I hate drawing blood. I hate getting my blood drawn, but I don't mind.
Why are doctors so scared? But we'll still do it.
Yeah, but I will say my first time, I think the only thing that like my patients have mentioned that they would expect is that sometimes with either Botox or even Daxify, that first injection sounds like snap, crackle, pop, but that's all normal. That's all normal.
Yeah.
But otherwise, people get used to it. I've had people who wanted numbing first, and they've gotten so used to it that they're no longer.
Yeah, I mean, most of my patients, initially, like, I mean, there is a really bad rap on Botox and Daxify. People think we're not making those things.
Yeah.
Because they're worried about what they're seeing on social media. No, it's not like, we don't freeze you. We just make you more attractive.
You look like you have a glow. Like it's just a
I
glow.
mean, like, like this.
Look at that baby face.
Yeah, so I just have my Botox on. I can still move and frown, right? Yeah. So that's how we do our data plastic, not to have you look crazy. Especially actually in the black community, people really scared of Botox actually, or Daxify. So just come talk to us. It's not what you think it is. It really is. But if you don't like those wrinkles across your forehead, or right here, or your crow's feet, that's what it's designed for. So you can look as, the goal is for you to look as natural as possible, and we want people to notice but don't know.
There's some really exciting stuff with the Botox and Daxxify. It's not just for the face, you can use it in other areas. It's off-label, but it's still proven to work really well.
Like for armpit,
Sweating, excessive sweating, you can have it on. If you want to slim your jawline, some people have really strong jaws and just want to slim it down like an heart, you can do muscular Botox. And then also, just like your lips too, it's called the lips, right?
yeah.
But I love it for smoking.
What is the weirdest place to place Botox? Weirdest.
I wouldn't say weirdest, but because in my training we do a lot of hand stuff.
Oh yeah.
We actually put it
for sweat.
Well, it's for sweat, but then also for Recon.
Oh yeah. So you could put Botox and vaccine off that, of course. Anywhere you don't want to sweat.
Yes.
I'll let your imagination go. Okay. Anywhere you don't want to sweat, right? Right. So I've done all that. Yeah, and it lasts longer. For the armpit or the groin, it lasts about 6 months. That's pretty much. So you do it twice a year. So if you sweat too much, you know what to do.
And then there's a patient that mentioned the neck too. They have what's called the nephrotubular Botox.
Yeah.
Get a technical, non-surgical neck lift with Botox.
Yeah. Okay. Anything about the Botox on you do?
I think
I actually put one with it. When I do a deep plane fixing, I put it around this on the supplement and I do the sweat stuff. So I remove so I want to have a nice, snatch neck.
Yeah.
So I remove some of the line, I put Botox so it doesn't sweat and it doesn't salivate.
Yeah.
And close it. So it just really nice and tight. So that's you probably don't know what that is. I just want to make sure we cover all Botox and Daxxify. So what else?
And before we go to the next questions, again, to those who just joined us, go ahead and ask your questions to our plastic surgeons here at Georgia Plastic. I wanted to remind everybody, September 20, we're having our Daxi Day, and 2 lucky winners are actually going to get complimentary Daxi. So save the date, September 20th. All right, let's move on to our next question.
All right.
So she says, hi, doctors. Could you tell us about alloplay? Is it permanent? Which minimum amount is visible? Do you use ultrasound or injection?
Oh my God. Okay, so how many ultrasound we have? We have 2, you know that, right? We have the 2. So when somebody asks me, is fat permanent? That is a problem, right? So is anything in life really permanent? Death and taxes are
And tattoos, like you said.
tattoos are permanent. But really though, the alloplay is other people's fat. And once we inject it, not all of it will survive, just like it will in VGF fat transfer, right? The ones that survive is your fat. That lasts forever. If you lose weight, you lose weight. If you gain weight, you gain weight. So unless somebody suck it out.
Yes.
Yeah. So it could be permanent. I don't like to use the word permanent because nothing really is permanent. You could lose weight and then it goes away. So once it survives is, what's the right word? I don't want to use the word permanent. Because I don't know.
More like maintained or sustained.
Sustained fat.
Yes. So we always tell our patients after they get their alloplay injections to eat well, protein and carbs, because we want it to survive. We want it to incorporate into your body. And then also you want to stimulate your own fat cells to start growing.
Yeah.
And
So
when it comes to amounts, I would say it depends on the individual. So if you have a pool of water, 1 drop is not enough. But if you have a tiny cup and you have to pour 1 drop, it's just all proportions.
yes, because we used to so much.
Oh, so yeah, I mean, if you think about how much is necessary, we don't really have a number for anyone. It depends on the individual. So if you have a pool, throwing a cup of water into that pool, you're not going to notice. But if you have just a bowl and throwing a cup of water into that bowl, it's a big difference.
However, on the average, like we saw 2 patients today,
I would say
so the smaller you are, the more it goes longer. So I saw a small petite patient this morning, and she wanted the hip dip filled. She had a BBL. She didn't have enough fat. She had a skinny BBL. So she still wants a little bit more volume, and I think we put a maybe 25 cc to 50 cc. All depends on, you can, I would say start small, but it's like filler, but fat. Start small, and you can add more. There's no, you're not burning any bridges.
Yes.
So after your consult, we're gonna recommend based on what your preference is, right? If you want to buy 200 cc, you can buy 50 cc or 25 cc. But like you said, if you're small goes a long way. If you're big, you're gonna need a whole bottle. Yeah, yeah.
And talking about the butt area, right? We're back to it. Is liquid BBL something you would ever consider adding to your service menu?
Absolutely not.
Ah,
That's something I cannot believe that people are still doing that. Like putting their life into it. You know, I did a segment in one of those shows. What's that show called? I don't think I should know on this stuff. What was that? It was on TV. Trafficked. What? Discovery?
National-
Investigation Discovery, right?
Yes. They interviewed me on that.
Wow.
Yeah, we consulted it. Yeah, I was on traffic.
You guys as doctors always on TV.
Exactly.
Yeah, he's on the radio. He's I'm gonna post that this week
Yeah.
because he's also on the radio. But yeah, he's always on
We
TV.
do traffic, right? So people are still getting their butt shot done, and so first, somebody asked to live in a hotel room, not a doctor's office. Office is cheap, and you're gonna put your life on the line, but not in a non-sterile environment, or in their garage or in the basement, and you go, but or once you end up in the ER, and now you're in surgery, now the general surgeons are coming to your butt. Not the look you're going for. So, no fillers on the butt. I'm sorry. We're still in the butt. So let's talk about how to enhance, give you a nice butt. Safe things to do in the butt is your own fat, number one. Number two is alloclay. Number three is implants. There are 3 things to enhance your butt. And number 4 is us. We can contour your butt, okay? So what we do is we remove the fat around your waistline, your thighs. We leave that fat kind of like recycle it a little bit, okay? And then give you a nice shape. Other than that, nothing else is safe really. Did I miss anything?
What about sculpture?
Sculpture is good. It doesn't need that much volume. I use sculpture to build collagen in the skin. That's what it's designed for, right? So, I've done sculpture for the last 25 years. I have a tremendous amount of experience with it. And it doesn't give you that much volume. It's for the skin people. It looks really good the first few. I know my sculpture reps are not liking me right now. But I cannot like competitions. I can't do that. It's just inevitable. It's good. Sculpture is good for it's great for skin tightening and give you collagen. Give you a little bit of volume, it's okay. But I don't use sculpture to make a butt look. Sometimes if you do it, if I'm asking my question, people before that, that's a problem. Okay? But it's a great product. I use it a lot for neck skin tightening, the hands, and the buttock to kind of tighten the skin. What is your experience with that?
So I would say like I want people to realize with sculpture, it's like not you'll see an immediate volume, but that's because it's water. You dilute it in a ton of water because you have to be concentrated. So you'll see it and then it disappears and people get, disappointed. But the way sculpture works is intended to work is that with time it stimulates your collagen to grow. That's why you need to keep up with it because also as it's growing, you're still losing. You don't stop aging, you still lose collagen. What I do like to pair with sculpture oftentimes is ice skull, which you have in matcha, or we pair it with tone, which we have here.
What's that going to do?
So it stimulates muscle contractions.
It grows the muscle, yeah.
So you're pairing collagen with your own muscle, and so sometimes like if people don't want something outside, they want their own natural body to create something, then that's something that I offer.
Man, that's a non-surgical butt enhancement.
But you're not going to get the big BBL. You have to be realistic. It's going to grow.
You just want to more like
Tone butt.
tone butt.
Athletic butt.
Athletic butt. That's so. And M-tone,
Yeah.
no, not
No,
M-tone, M-sculpt and
yeah,
tone.
and tone.
All right.
Those are two options, but again, it's not one and done. It's a few series to get something until you're happy, and then you want to maintain.
And I want to say the last thing about sculpture and butt is when we as a surgeon want to look at the butt and see skin and fat. And sculpture doesn't make that. So to make your butt big, you increase the muscle and increase the fat. Right? Make sense?
Makes sense.
All right.
Perfect. So let's talk about stretch marks. I know a lot of women have it, a lot of men have it. So they want to know any new technology besides Morpheus 8 that can remove stretch marks off my stomach. I got a tummy tuck, guys. I'm gonna be honest. That was my way of removing my stretch marks. But I would love to hear if you guys recommend a tummy tuck or what do you recommend?
So stretch mark, there is no cure for stretch mark. Okay, if you have it, you got it. If you're lucky to have it where below the belly button and you need the tummy tuck, that's the best way to remove it. However, not everyone needs a tummy tuck or one tummy tuck. So we can make the stretch mark less and prevent it from getting worse. That's why we have all this technology like Morpheus, I'm looking for that. And sculpture is good for it too. I love sculpture. It tightens it up. So I like to combine. So for me, no one thing is perfect. Okay, so I like to combine technology like bioengineered abdomen, bioengineered butt, bioengineered breast, bioengineered face. That's what we do. So I want to combine sculpture and Morpheus on the skin. That gives me the best skin tightening. And when skin is tight, what stretch mark really is a break in your dermis. When you look at your skin, it's broken into epidermis and dermis. That's what skin is. So when you have less collagen on your dermis, you have a breaking, you have a stretch mark. So sculptura and Morpheus allows you to build that collagen back. So the stretch mark does not get worse. It doesn't go away. It looks better. Plus, when we're done with that, we percentage that are matching my scar. They use the other microneedling not to kind of build the superficial collagen really good. It doesn't go with it. You can improve it significantly.
Yeah, I agree. I would say like the only thing I might add to that sometimes is I love fat, so I like to use fat sometimes.
Oh, none of that. You win there. Okay. All right. They may not know what none of that is though.
So basically, it's still your own fat. I would not do it with alkaline. It's your own fat. Basically, when you process it until it's like micro droplets, and it's got the cytokines, it's got all the growth factors.
They don't know what cytokines is. So you need a growth factor.
So it's stuff that's in our body, and we already produce it to help our cells grow. And so what I like to do with one of my patients, the only reason I started thinking about this is with my facelift patients, when I added fat to these areas like they need more volume, they told me that, like, hey, my skin is glowing and my skin actually gets healthier. And it was every single person I've ever found.
Is there stem cells in that?
I mean, I think with fat, there's stem cells.
We can't claim it.
Yeah, we can't claim it, but it is your own fat.
We do. It's what adipose-derived stem cells. Right? I think that's what makes the skin. Even with the face, fat graft to the face looks better. Yeah, fat graft to the butt looks better. Anyway, you can find that the skin improves. So,
I 100% agree. So I sometimes, it won't get rid of your stretch marks, but it makes it big hair better.
I think I saw somebody ask about vaginal rejuvenation.
Yeah.
Yeah. So how do we do that? So people don't know what that is, right? So with women's health, nothing's up to date today.
Nothing is on the table today. It's a fire Q&A.
Yeah. So we do different procedures for vaginal rejuvenation. Which one's your favorite?
I mean, it depends. So, like, radial, the common radial class, I'm sure a lot of people know about radial plasty.
Yeah.
It's not that
Just use common word. Don't use big word. I know you got a PhD and stuff. just talk to normal people and stuff.
So, so the what do they call it, the lips?
Labia.
The labia.
Yeah.
Not these lips, the other ones. But those, if it's kind of stretchy and a little saggy, then you can always trim it out, make it look nice and more rejuvenated.
So that's the labia minora. How about labia majora?
So some people lose volume as they get older, and they puff it, and they call it a radial puff.
Yeah.
You can do alloplay or your own fat.
Oh, I've done filler too.
Remember,
Labia filler.
those areas are acceptable.
Yeah.
There's areas where you don't want it, and there's areas where you want it, that's acceptable.
So that's on the outside, yes. And one more thing, the skin on the outside, we also do the tightening with what? Morpheus or Amoeba. Okay. Okay, now we'll go inside. Yes,
No. What is it called?
it doesn't matter. There's
Radio frequency.
radio frequency, yeah. All right, motivate the implant.
Yes.
There's so many things.
I know.
So inside we can make it tighter with that cutting, that's Amoeba. If you have had children, you want to make it smaller, we'll do like a what's called a vaginoplasty, and then there's perineoplasty. Yes, I always combine the vaginoplasty. Vaginoplasty will make it smaller. So the perineoplasty makes the pelvis tighter, right? Okay, I guess you want to talk about male enhancement.
Yes.
All right, so what you can talk about that.
Yeah, so there's lots of options now, and so what's
For men.
For men, yes,
Okay.
lots of options for men. If you're thinking about girth, not so much like, some people anecdotally say that it gets longer, but you can always have to that'll give you girth. But the other thing too is we have this awesome device called APAS. It's meant for erectile dysfunction or ED, but because of how it works, it's stimulating blood flow, it's increasing blood flow to that area, and so technically it should also enhance girth as well. I love pairing it with PRP, which is
What is PRP?
basically your blood, the platelet aspect of your blood, when you inject it in that area. You make sure that it's completely comfortable and numb, but again, it's a series, and you get to your goals.
So you mentioned FX. How about that one? What in the FX, do you need to go speak to that?
No, completely awake. You can either watch your phone, watch a movie on your
Listen
phone,
to music?
listen to music, or doze off.
How long work it?
Like probably, I would give yourself the actual procedure probably takes 15 to 20 minutes, but give yourself 30 to 40 minutes just so that you have time to prepare everything and make sure everything's nice.
So you did mention ED though. So the incidence of ED, they say 70% of men at age 70 have ED, 50% at age 50 have ED, 30% I didn't remember that. So a lot of people struggle with that. I think one thing I like about the FX, there's no medication, there's no downtime, there's no injections, unless they want to hear a
Exactly.
and just an outpatient procedure, no downtime, you guys will be intimate from there as well.
Exactly.
And I know our patients that talk about like you really happy with therapies for them. Is that an indication?
Yeah, it's been great reviews. And anecdotally, again, they're also saying that not only are they getting better or stronger erections, they're morning erections, and actually they're noticing.
Dude, slow down, man. This is PG now.
They seen an increase in their girth, too. Which is not something that we.
Nothing was off on this thing.
Yeah.
Is there anything else, any other questions that you want, is there anything else?
Is there anything else?
We can cover the whole.
Yeah, I feel like we covered everything.
Hair.
Oh, yeah.
My favorite.
Yes.
So, hair. So you're losing hair
Yes.
from GLP-1s and stuff like that. What are options for hair?
And it's hair restoration month.
Yeah.
Hair restoration month, and so they're definitely called hair transplant. You take your own hair and put it in areas that you're losing hair, and it's completely awake. You don't have to be asleep for it, and keep it comfortable, and it's your hair.
Yeah.
So here at Good Plastic we use smart graft. That's the surgical part. We also have the non-surgical stuff for like growth factors and inject PRP, growth factors, can even prescription for other things for your hair. Especially if you're losing what you're losing, come see us. It doesn't always have to be surgery.
Exactly.
Yeah. I think that's it. Anything else?
I think that's it. Someone wants to know about the tummy tuck recovery, so maybe we can just talk about that just a little bit, how the recovery you guys feel that it is.
So this is one thing I'm very, very passionate about recovery. I mean, for me, if you have a tummy tuck and you're not plastic and you're in pains, I mean, most of our patients don't have pain like that because we use extra. We do the blocks with extra and it keeps them numb for about 3 days, 72 hours. So with most of our patients take about 2 weeks to walk, unless you can walk from home. And I want my patients to walk in straight from the OR table. I don't want to bend over. Most of my patients should not after your coming up, you should not be you should not be miserable. Yeah. Ideal is not even an option to have a coming up and get that plastic that extra wear. Yes. What I tell patients, pain after coming up is optional. Yeah. People say, what do you mean by that? Because I have to keep you comfortable.
Yeah.
I would not do a coming up with an extra anymore.
But you still have to realize you still have surgery,
Yeah.
so we don't want you doing jumping jacks.
Mhm.
So we will keep you comfortable, but there's going to be a little, you're going to be sore. We like to say sore.
Sore.
Yes.
You're gonna be sore. You should not be miserable.
Yes,
That's
you're
it.
not going to be miserable, but everybody loves it. Yes, it is worth it. It is worth it.
All right. Wow. This has been a wow.
Yeah, this has been a wonderful conversation.
Oh my God.
We love talking to you
Is there
guys.
anything else that we need to talk about?
No, I think we talked about the entire body. A lot of people want to see us live more, so that's definitely something that we
Alright.
want to do.
We can do this next week.
We can, guys.
Maybe
So
on a regular basis, on a particular day and time on Thursday, or no, maybe TBD.
TBD, we're busy with TV and radio and surgery, guys. Okay.
I gotta be in surgery. I can't, if your plastic surgeon is talking on TikTok and Instagram all the time, when is he doing surgery?
Yeah.
I was asked a question. I'm too busy for doing this stuff, man. Anyway, I really enjoyed this session. I mean, the more questions people ask, the more and these are questions that people ask. So I want to thank everyone for giving us the opportunity to come to your place of work, at home, and wherever you are, all over the world.
And we just got one last question. They don't want you guys to go today, okay?
All right.
Could you say that nanofat is similar to Renuva?
So Renuva has no fat. It is an extracellular matrix that stimulates your body to make your own fat.
How about Alloplay?
Alloplay has, basically it's Renuva plus fat, but it's a donor fat. It's not real fat. And so also the whole point of Alloplay too is also to stimulate your fat to grow. And you've already got that, that jump start with some of that.
And both Renuva and Alloplay still have some growth factors in their flavors. But they're not, don't have the fat, but they're not nano-fat. Yeah, different things. So we offer all of them. So that's important because
Yeah.
if you have a hammer, everything looks like a nail. So we have all of the above. Yeah. So it all depends on what you really want. So we can actually customize it to that.
Okay, perfect, guys. So like I said, we will be doing this again. But in the meantime, if you have any questions and you don't want to forget, send me a DM. I'm always here. If I have to go grab the doctors before surgery and ask them your question, I will. So feel free to follow us, send us a DM, and put your notifications on when we post so you guys can see our latest and updated news and when we go on live as
So
well.
let me say that again. So you know what to do. Follow. Follow button, follow us. And Angela Plastic, right?
Mhm.
And maybe go to one more information, go to the website. What's the website again?
WhatYourPlastic.com.
Yeah. So we will be back and whenever room is open. Yeah, great. This is awesome. So anyway, woo, man. Anything else?
That's it. Thank you so much, everybody.